lupus, and this risk is small. However, a lot of them do develop a positive anti-nuclear antibody test. It's difficult to know the significance of that because we're seeing it more and more, but these people rarely have clinical lupus, or if they have anything, it's just a rash. Question 5. A 34-year-old woman presents with a 5-day history of right calf swelling. She's 3 months pregnant. This is her 3rd pregnancy, having had 2 first trimester miscarriages previously. Her past medical history includes migraine with aura, and she's been taking regular folic acid and iron since conception. On examination of her upper limbs, she has a rash you can see in the photo here. Might describe it as a maybe brownish neck-like rash, maybe. Blood test shows she's got a hemoglobin of 10.2. She's pregnant. Her platelet count's low, 94, and her APTT is elevated at 54. And the other tests are unremarkable. What is the unifying diagnosis here? A. Antiphospholipid syndrome, B. Behçet syndrome, C. Protein S deficiency, D. Sjögren's syndrome, or E. Systemic lupus erythematosus. So the unifying diagnosis here is the antiphospholipid syndrome. And actually, what I described in that case, some of the history of miscarriages with that low platelet count, the raised APTT, that fits perfectly. We'll come back to that. Part B of this question, screening for antibodies against which 2 of the following would be most useful? Oh, you've got a long list of antibody tests here. Cardiolipin, double-stranded DNA, HU, Jo1, mitochondria, myeloperoxidase, rheumatoid factor, RNP, Rho, and smooth muscle. So the answers here are cardiolipin and Rho, and these are for 2 very good reasons. The antiphospholipid syndrome is a syndrome characterized by the presence of antibodies against what was first described in cardiac tissue, lipids in cardiac tissue, hence the name cardiolipin. We now know it's against something called the beta-2 glycoprotein 1 molecule, the beta-2 GP1 molecule. But on the test form, it often still says anticardiolipin antibody. I suspect over the coming years it'll change to beta-2 GP1 test, and that'll be essentially the same thing. The other classic manifestation of the antiphospholipid syndrome on the blood picture is the presence of a lupus anticoagulant. And this is a paradox because it's an artificial anticoagulant in vitro, but actually in vivo it's a procoagulant effect. So the APTT appears elevated, but actually the patient is at increased risk of thrombosis. The antiphospholipid syndrome can be primary or secondary. If it's secondary, it's classically in association with lupus. And that's why the other test here that's of interest is anti-Rho antibodies, because these have implications from a pregnancy point of view. Rho or LA would have been an alternative, and the other names for Rho and LA are anti-SSA and anti-SSB. Those are interchangeable words. The reason these antibodies all have funny names, I think it's probably fair to tell you. They were named after the first 2 letters of the surname of the patient it was first described in. And I think it probably breaches patient confidentiality to tell you those names. Anti-Rho was named after Patrice Robert, I think. There's a long list of the other patients these have been named after. Anti-Jo1 was named after John somebody or other, because the person that described